Assalamualaikum and hi everyone. We are from Group 1. Today we are going to present about factors encouraging e-health.
Introduction. E-health, also known as electronic health, it is defined as the use of information and communication for health. E-health equals to medicine plus communication plus information and plus society. It is an emerging field in the intersection of the medical informatics, public health, and business, referring to the health services and information delivered. E-health is cost-effective and secure use of information and communication technologies in support of the health and health-related fields. There are 8 factors encouraging e-health, which are patient demands, new functions, democracy, health workforce, technology, national policy, economics, and safety.
First of all is the patient's demand. As the world modernizes, many people find it is very useful for them to use technologies in order to maintain their well-being. Firstly, for chronic illness patients, e-health helps them in keeping track on their hospital appointment. This is very useful for elderly people who tend to be more forgetful on their hospital appointment. The device will alert the user by giving reminders. Next, e-health also allows patients to monitor their health status. For example, the invention of the smartwatch allows people to track their heart rate. This allows the patient to be more alert on their health status and also allow them to share the data with their doctors. Last but not least, e-health also allows patients to have access on their health electronic record. For example, in Australia, an application called My Health Record was introduced to allow their citizens to track on their health record, which encouraged them to take greater control of their health. That's all from me. Thank you.
Okay, for new function is e-health can leave previously distinct service and information. For example, is where all information and form from different government departments could be accessed from one portal. Next is it also can disseminate and exchange information through networking between functional heads for control and planning. E-health is transforming decision making, information sharing, and patient education. Okay, for example, is in CDSS can improve patient safety through checks for drug allergies and drug-drug interactions by providing evidence-based recommendation and prescribing guidelines. And then e-health can merge global technologies onto one platform so that it can be more faster and more accurate diagnosis and treatments. And then it enables quick access to patient records. And then lastly is for improving patient and provider interaction and communication.
Next factor is democracy. E-health could allow the citizens that have the same view, goals, and thought to form the pressure groups. So, from the formation of pressure groups, we'll able for them to express the view, especially for minority groups in the community who might not otherwise receive a hearing that is related to health. So this will lead to formation of democracy, where the supreme power is vested in people. For instance, e-health allows citizens to set up their own health organization. Benefits of democracy in e-health. First, each party can prove and negotiate the rights, benefits, and obligations at equal stance. Besides, each party can follow the same protocol for data sharing without discrimination. Other than that, each party can configure their data sharing policy automatically and intelligently. Next, each party can share the profit from data use in a secure and trusted way.
The next factor is health workforce. Health system can only function with efficient health workers that help improving the health services. The chronic underinvestment in training and educating the health worker occur in some countries, along with not giving them the right occupation based on their knowledge. Increases in population contribute to continuous shortage. Impact of e-health in health workforce is availability, accessibility, and quality. In availability, e-health reduces the paperwork and make the access to information faster. In accessibility, e-health enables the healthcare to diagnose problem and monitor patient condition even with distant barrier. In accessibility, e-health make communication with patient easier and more direct without miscommunication. And in equality, it has to give provider rapid access to valid information and guidelines that improve the patient safety and service effectiveness.
Factor is technology. In this era of globalization, technology plays a major role in the development and evolution of all sectors of our civilization. This is due to advancements in computer and communication technology. The implementation of information communication technology (ICT) in e-health is one of the most rapidly growing areas in healthcare today. So let's see its beneficial on how technologies improve health industry. Firstly, it is easily accessible medical information. People can consult the internet for answer to their ailments since everything is on the internet. Next, with the advancement technology, it can provide better treatment, equipment, and medicines. For example, better equipment has allowed doctors to provide more comprehensive care. Next is technology can improve relationship with patient by allowing medical record to be transcribed online between doctors and patient. Next can predict outbreak by creating database from people's research. With improved technology, it is possible to get the result as soon as the lab test is finished instead have to wait a few weeks or months to get the result. And lastly, technology has large presence on social media.
Next factor that encourages e-health is the national policy. E-health policy is a set of statements, directives, regulations, laws, and judicial interpretations that direct and manage the life cycle of e-health. According to WHO, the most favorable approach to the implementation of e-health at the national level is to have a framework of strategic plans and policies to protect citizens, promote equity, observe cultural and linguistic issues, ensure interoperability, and allow for capacity development. Since 2010, the Global Observatory for e-health has been creating and updating an online directory of e-health related national policies and strategies from member states. The countries that have implemented the national policy of e-health include Malaysia, India, Canada, and France. For example, in Malaysia, there is the Laws of Malaysia Act 564, the Telemedicine Act of 1997, that provides the regulation and control of the practice of telemedicine to protect citizens from doctors or others who might not be clinically competent.
Next is economic. From economic point of view, e-health can help in relieving the burden of hefty healthcare costs since the costs put a pressure on the payers and providers. As we can see here, the graph shows the rising of the healthcare costs in the United States. Healthcare cost is an important concern for patients, clinicians, and policymakers as whether it is possible to control the cost while maintaining the quality of healthcare services. One of the benefits of e-health is cost-saving potentials. Some studies have found that monitoring patients at home avoids referrals and hospitalization. Access to relevant patient information and medical expertise to support local decisions can avoid expensive hospital visits. Moreover, avoid referrals and visits have the potential to reduce patient costs associated with seeking medical help.
The next factor is safety. The safety factor basically consists of two main parts, which are data storage management and retrieval system, and the other one is supporting decision clinical making. For data storage management and retrieval system, PACS is one of component in e-health, which in terms of safety, PACS increase productivity of radiology services, reduce transit times, and reducing physical space requirement for image. For the supporting decision clinical making, with regard to safety, e-prescribing is vital as it reducing error in the prescribing process, improve patient outcome, and increase ordering of coronary care. Meanwhile, for CDSS, they issue certain alerts or prompts which can take either an active or passive form. Furthermore, increased provision of preventive care measure, disease-specific examination or measurement. Next, corollary order to monitor side effect. And lastly, decreased use of unnecessary or redundant care.
So before I jump to the conclusion, so I will conclude the 8 factors that are encouraging e-health, which are patient demand, new functions, democracy, health workforce, technology, national policy, economics, and safety. And for the conclusion, e-health is not characterized by the technical developments, but also a new way of thinking, attitude, a commitment to improve the healthcare locally, regionally, and worldwide using the information and the communication technology. So these are the references that we use. So thank you.
So that's all from us. Thank you for your time. Thank you for listening. With that, we thank you. Have a nice day.